Hot flashes, mood swings, and brain fog. Those are some of the more common symptoms of perimenopause and menopause people do talk about.
But did you know women may also experience skin changes, hair thinning, even heart palpitations?
Be lucky you're a man. There's another very important change too that's not often talked about. Your desires in the bedroom that can affect your intimate relationships. I talked to a sexual health expert to get answers.
There's lots of non-hormonal options. One of them is a medicine called Bioza, but it's strictly for hot flashes and night sweats, and it's a tablet that you take every day.
Dr. Carrie Anthony is a local menopause and sexual health expert. We caught up with her inside Cedar and Lily Clothier at Tulsa's Utica Square as she empowered women with information on perimenopause and menopause through a shop, sip, and learn type of event organized by the American Heart Association. She took a few minutes to sit down with me to talk about the hormonal imbalances, which can feel like a roller coaster, as described by shopper Deidre Detterman.
I think just all of a sudden breaking out in sweat for no reason is crazy, right? Like, when in your life do you ever do that?
Hot flashes and mood swings, anxiety and depression. Welcome to the Perimenopause Menopause Club.
And the average age of menopause in the U.S. is 51. So really you could start having symptoms at 41, and for some patients even at 36, 37, 38.
The big topic I dove into that a lot of women and their partners want to know about: the loss of sex drive, a low libido, and it's very important in any relationship. And so what are some things that do happen to women, and what are some things that can help women?
Yes. So that's probably my biggest passion in this whole journey, is recognizing that, you know, as we go through this transition, our bodies are moving from a pro-reproductive state. When we're in our 20s and 30s and we are built to reproduce every month, so we are ovulating, we are producing an egg, and our bodies want that egg to be fertilized, we get all these signals to reproduce. So we have a sex drive that's kind of spontaneous, right? Like we might, you know, have a hormonal signal that says, right now is the time that you're most fertile, and so you should be intimate at this point.
But when you reach menopause, which is when you've gone without a period for 12 months, you're no longer getting those hormone signals. Dr. Anthony says those signals start fading in and out up to 10 years before menopause, and the time frame called perimenopause, which can start for some women in their mid to late 30s.
So we have to work a little bit harder, and we may not have that spontaneous desire anymore.
She says it's so important to talk to your partner and to your doctor about what's happening to your body, especially if you're feeling any pain.
So for many women, vaginal dryness is a key part of this transition, and that only gets worse as we get older. So treating that symptom and actually being able to talk about it and go into the office and say, I'm having pain, whether it's with intercourse or even just with sitting during the day, or if you're having more recurrent urinary tract infections because the tissue in the vaginal area is thinning as we get older. And so vaginal estrogen, which is not the same as hormone replacement therapy, is very helpful, and it's not considered systemic therapy. It just treats that tissue. That's key. Having the conversation as well is key.
Dr. Anthony says hormone replacement therapy can also help, and there are medications that specifically help with libido.
There's a couple of FDA-approved medicines, and then there's testosterone, which is not FDA-approved, but it is absolutely useful for libido in perimenopause and menopause.
The women listening to Dr. Anthony had no idea there were so many treatments available.
I was surprised by how many options there was, and I think that it's positive, right? There's all kinds of options for women to improve symptoms, and I think it's a good thing.
There are options available, so we don't have to live in misery.
There are options, and I found that, you know, the option that I had been on originally maybe not the best thing for me. So finding that out and being able to know what to ask for when I go talk to my physician, I think is going to really help as well.
We need to kind of open the door and start that conversation so women will be aware of what these symptoms are when they happen.
Dr. Anthony would love to see all of us women talk openly and easily about menopause, just like we do when it comes to fashion and shopping. Now, if you don't feel like you're getting answers from your current doctor, Dr. Carrie Anthony created yourmenopausemd.com, where women can schedule telehealth visits for a personalized treatment plan. Now, next Monday at 5, our series continues with how menopause affects your brain. Then on November 3rd, don't miss our 1-hour special when Michelle Lynn, Jana Clark, Sunny Lee, and I all sit down to share our personal experiences and what's helped us.